So I'm going to try to do this education piece a little bit differently. Actually, what I'm going to do is I'm going to go through the most common complaints. Maybe it'll relate a little bit better and help you understand the procedure just a little bit more. So the number one complaint that I get after doing BBLs, liposuction, or any plastic surgery procedure is, "But doctor, my left side looks very different than my right side." And I go, no kidding. Why is that? Because the left and right sides are completely different. As a matter of fact, they're not even related. If they were, they'd be more like cousins rather than twins. So your left side of your body, no matter how good looking you are, no matter how perfect you are, is always different than your other side. So I will never be able to fix that because it has to do with the bone, the muscle. There's so many structures involved that I can't deal with or work with that will never be corrected. Sometimes we try to improve the degrees of asymmetry, but we will never get it 100%. So for sure, 100% for sure, expect to have asymmetry between one side and the other. Sometimes, like I said, I can try to improve it, but it'll never go away 100%. So the second biggest complaint, can you guess what it is? Wrong. Well, maybe you're right, I don't know, but doctor, it is not big enough. That is the second biggest complaint that we have. The problem is that I'm going to do everything I can. I'm going to take all your fat, I'm going to put it in the buttock, and I'm going to put it in until I run out of fat or the fat starts to squirt back at me. I mean, there's only so much you can put in a certain drawer, right? You can't put any more in there. The skin only stretches so much, so I'm totally limited by your anatomy in terms of how much I can put in there. Now you got to remember, it'll never be huge. It's not like the Michael Jackson nose where they think they had one surgery and they made it that tiny. No, that took like 30 surgeries. So getting those really big butts is definitely more than one surgery usually. But let's go back to the first surgery that you had, and that is that I'm limited by the amount of skin stretch that you've got and the volume that I can put in the buttock. And then only 50 to 60% is going to stay, so we got to give it some time to see what size you'll end up having. The third complaint, do you know what that one is? Close. Really, they say to me, "Doctor, but my cellulite didn't go away, or it's worse, or my dimples are still there, or it's flat in a certain part of the buttock." And you're right, this does not cure dimples, this does not cure cellulite, and those dimples that you see in your body or those tight areas are exactly that. Those areas are so tight that I just can't expand it at all. I'll do my best to get it to expand, but your skin sometimes is so hard and so tight in that area that no matter what I do, it just won't stretch. Sometimes you got to come back and do that a couple of times before it really stretches. So the example that I always give is, imagine a pair of tight shoes. You get them as tight as you're going to get them. You can't get them any tighter, but then 6 months later, it's really, really loose. And then they're like super loose. So there's only so much I can do, and it'll be up to your body to see what it lets me do. So we just got to give it time. So don't expect cellulite to go away, the divots, the dimples, the tight areas. That's just not what this procedure is about. This procedure is about reshaping it, making it prettier, perkier, and yes, if you want to, about volume. The fourth one has to do more about liposuction. The complaint is, "Doctor, I still have a little bit of fat," and they use the weirdest poses you're ever going to see. I mean, these are like Cirque du Soleil type movements where they're bending, they're stretching, they're saying things I've never seen before, and they're saying, "But look at this little fat that I got over here." Well, I could never get that fat. Remember, you can't get every single fat cell that there is, and sometimes you're limited as to how much you can remove because of your fat characteristics and your skin characteristics. What do I mean by that? Well, some fat tends to leave irregularities. It tends to leave the track marks of the cannulas. It just is not forgiving at all, and it can really destroy the body. So I've got to be very careful in those situations, and everybody's different, and I can't tell until I'm there. The other one is the skin may not retract as much, and so I got to be a little bit careful there. I also have to be careful because I don't want to create burns or even those bad irregularities that I was just talking about. So oftentimes I'm very limited as to the amount of fat that I can take out, and often we leave more fat than you would have liked me to, but I'm doing it for safety reasons, for aesthetic reasons, and so don't expect to have every single fat cell be gone. The complications go up the roof when you try being that aggressive with it. And even if we try being conservative, complications can still happen. So make sure you look at your benefits, risk, complication packages that we will send out once you've booked for surgery. So I can't wait to see you. Make sure you talk to your coordinator. She'll give you your price quotes. She'll take you through the process, and then we'll see you in your pre-op appointment. Have a great day. Stay safe.